Girls patient took sorry. The next speaker is Dr. Biju Singh, and the topic is managing stretch marks during pregnancy. I know Dr. Singh is a very good speaker and has a lot of knowledge. Prevention and treatment of stretch marks is the ever-rising question by almost all mothers. Let us see what he says.
Thank you. Good afternoon. I'm trying to contract stretch marks and bring it down to a capsule of 8 minutes to 7 minutes, so please bear with me if I rush through my slides. Now, why am I going to talk about stretch marks? Probably because we doctors, we physicians, we obstetricians don't care too much about stretch marks, do we? We've tried stretch needle, we've tried stretch zero, and nothing seems to work. But there is a growing awareness. The modern Indian woman today is very, very concerned about her abdominal stretch marks. So, if we have to know about stretch marks, we have to recapitulate a couple of things about the largest organ in the body, that's the skin. Now the skin, well, has epidermis and dermis, and most of the problem lies in the deeper layers, in the dermis. So trying to understand the skin a little bit more, you have to understand that collagen and elastic fibers form the biomechanical support of the skin, and they are the important components. Another important component is the hydration level of the skin. People sleep at night with the air conditioner on, they have a saucer of water next to their face. Hydration is the secret probably of all those beautiful women in this room too. So hydration forms an important part of the skin properties. And you can see here how dry skin looks horrible microscopically. And how can we prevent this dehydration? Well, we have to go back to pharmacology. Emollients and moisturizers, what are they? Well, it's a Latin word meaning something that softens or smoothens the surface of the skin. So we need moisturizers, we need emollients, and probably with these tools we can tackle this problem of stretch marks. If we look at the skin in pregnancy, we see a lot of changes ranging from here, but what we're interested in is stretch marks. And are they common? Well, they are, because they do affect women, and as high as an incidence of 90%, and mainly in the second trimester. It is a matter of concern. It is definitely not life-threatening, but people are generally concerned about it. So looking at the etiology of stretch marks, well, we have to understand there is a rapid stretching. It could be because of the growth spurt. It could be because of obesity, but in pregnancy we also know there's a lot of stretching. Now this stretching leads to dehydration. So there is an increased transepidermal water loss. There is biomechanical properties which are disrupted. The elastin, the collagen, these fibers rupture and you'll end up with stretch marks. So if you have to tackle this problem, if you have to do something preemptively, you have to attack here, here, and here. Meaning which, prevent that rapid stretching. That's why you go to the gym. Before you get pregnant, tone up your abdominal muscles. Try to improve hydration. You've got to have certain substances, creams or whatever to apply. And biomechanical properties as collagen and elastin has to be regenerated by various external means. So if we look at striae gravidarum, it's quite common. We've seen somewhere around 24 weeks, but you can see it also somewhere around 15 to 16 weeks. Meaning which, whatever you have to do, you've got to start early. You've got to start somewhere here in the first trimester, or probably even before you become pregnant. When we look at the prevalence, it's very common in primary gravidas, so it's definitely there. But do we have any weapon? What do we have in our armory to tackle and get rid of these stretch marks? Probably we have something miraculous, maybe we do. Now, when we look at stretch marks, we look at the treatment options, and we have treatment options, but none of them are 100% effective. We have preventive measures, and probably prevention is what is going to be the mainstay of our treatment. When we look at preventive measures, we have so many oils. I'm particularly fond of cocoa butter. And we have corrective measures too, but unfortunately, corrective measures cannot be implemented in pregnancy per se. So we have to think of corrective measures only after the pregnancy is over. So lasers, topical retinoid microdermabrasion. I will talk about lasers too briefly later. So if we have to look at any product, there's a product here which has been recently launched about a fortnight ago. Unfortunately, I have no personal experience, but there are lucky 13 ingredients, hopefully. The main components of this particular product is water, hydration, as I said. So hydration along with lipids, a lipid layer that forms over the skin preventing water loss. Along with that, glycerol. Glycerol fatty acids again acts as a hygroscopic agent. It is also a humectant. A humectant is a substance which takes water from the external environment and pushes it into the skin. So glycerol also seems to improve elasticity if you look at the journals. The elasticity is important because the skin would stretch and come back to its previous shape and position. Glycerol again improves hydration, so it's all about hydration. Another component of this product is lactic acid. The skin is acidic. It's about 4.5 to 5.5. That's the pH. So you have to maintain the acidic level, and that's what lactic acid does. You have alkaline soaps, and they probably harm the skin. So you need an acidic environment, and this particular product has lactic acid, which also acts as a humectant, improving hydration. So if you look at the dual action, where there's active hydration and passive hydration, active meaning the humectants, whatever, absorb the water from the external environment, and the passive hydration, which forms an occlusive barrier, keeping the hydration within the epidermis and dermis, is how this functions. And it's proven that both active and passive hydration works better than passive alone. So hydration improves elasticity. We have journals to prove that. In a Mexican study where this particular product was used on 120 women, 60 were controlled, 60 were divided into two groups, 30, where it was applied on wet skin and dry skin. We have some results. Let's look at their study, which they started in 16, 18 weeks. Women who applied it definitely saw that the skin hydration improved. The elasticity also was improved. It's inversely proportional here. And surprisingly, and very astonishingly, so that more than 50% of women who applied this product in the wet group did not develop stretch marks at all. And that's really interesting. So with the wet application, definitely it was much better, and that's the summary that I just mentioned. Now, this product seems to be safe in pregnancy, doesn't have any toxic ingredients. The FDA approves of it because it's got lactic acid at 2%, much less than the 10% that is required. So probably we have something here that we can look at as a preventive measure. But do we have something for corrective measures? Well, I personally like the fractional carbon dioxide laser. I have used it in 2 subjects, and probably this is a more definitive treatment, but after pregnancy. Now, when we talk of fractional laser, we mean it delivers the energy to a fraction, a small part of the skin. It has a deeper penetration level, acting at the collagen and elastin fibers, which are deeper and below. Now, the old disrupted collagen is destroyed, and new collagen synthesis happens through the activation of fibroblasts. So probably this is what we should be looking at, and not at other forms of lasers which have a lateral term, spread much more fractional, and doesn't go that deep enough to touch the collagen layers. So fractional laser probably is the answer, and you can see from this model how deep it goes, deeper into the dermal layers, stimulating the fibroblastic tissue. And you can see me here. This is not Pakistan attacking India. It's not thermal warfare or whatever. But this is definitely the machine here, where you can see the articulated arm, which has a certain degree of freedom, and the scanner here, which we occasionally pop on ourselves to show the patient that it's not really harmful. It's a very easy interface to work with, and sorry, just a little bit more. So we have a touch screen here, very simple to use. A person like me can use it, and you can calibrate the energy source through the active scan to whatever shape, size, or density, and the number of exposures. So it's very simple to use. Most of the people who use it are not people who are even doctors. So you'll be surprised to see a lot of this happening in small clinics in and around the city and across the country. So that's the scanner there, and the scanner sort of got a software so that most of the calibration is done, and you can fashion your target area to either a small little rectangle like that, or it could be circular in that manner, or it could be linear. And through the foot pedal, you can deliver the energy just by pressing it. Now, fractional carbon dioxide laser is definitely permanent. We recommend it after 3 to 6 months of delivery, not during pregnancy. The efficacy, of course, is there, but the safety hasn't been proven. It is definitely going to reduce the stretch marks. Not 100%, but definitely going to reduce it. There are minimal side effects because it's a fractional laser. The energy is very precise. It doesn't have vacuum thermal spray. So what happens is you don't land up with burns that you normally see with other lasers. So people like you and me, occupational gynecology, probably could use it. There is a little bit of burn that might occur. The downtime is about 7 days, meaning which you have to stay out of the sun for 7 days. But stretch marks generally happen in the abdomen, so that's a covered area in a country like India. Sometimes hyperpigmentation might happen or hypopigmentation. So before delivering the energy, sometimes we do a patch test. So we do it to one area of the abdomen, wait for 15 days, see the response. If you're happy with it, the patient's happy with it, then probably you go ahead and do the rest of the abdomen. We do avoid it in certain conditions where there's a tan or where there's diabetes uncontrolled, there are chances of keloid formation, then we try to avoid the laser. So you can see some results. These are, I'm sorry, I've stolen it from a dermatology friend of mine. You can see before after definite reduction, abdomen, breast, and you can see here a very elegant example of an untreated area and a treated area. So in conclusion, probably we must understand that now there's awareness about stretch marks. People do want to get them removed. There are preventive measures which probably, prevention is better than cure, and corrective measures which are available too. The preventive ones seem to be safe in pregnancy. Corrective measures should be left for after the pregnancy and have minimal side effects. And probably we would have a term that I coined here, obstetrics cosmetologists. So probably some of us can become cosmetologists. So thank you very much for your kind attention, and let's try to do a smart time. Thank you.
Thank you very much, Dr. Singh. Unfortunately, we are running short of time. So if any interactions, please ask them at the time.
After lactation.
I was told that it doesn't do any harm.
No, it doesn't do, but we don't have it FDA approved yet.
May I please invite Dr. Kamal Kumar Ray and Dr. Vishwajit Ghosh as the chairpersons for the next session.